What's the deal, good people? It's Dr. Q Jordan with Fearless Physical Therapy. Hopefully everybody is enjoying their Friday. I know I am. Been pretty busy today, so we're going to get right to this. I received a couple messages from people talking about how they're having problems with their hip and what are a couple things they can try before they can get in. And so I'm going to show you two distraction techniques. But the thing is, it's imperative that you do go in to see a skilled physical therapist like myself or somebody else to get fully evaluated. Because what I'm going to show you today is only going to help certain issues. It's not going to help everything. And if it's an issue more so at your back or another joint lower than your hip, it's not really going to help at all. So you need to get fully evaluated before you try these things. But, so, what I have is a sports cord here. You can also use a pulley or a cable if you're at the gym. I have it anchored in here. And what I'm going to do is I'm going to stick my leg in and get the band up at my groin area. And it's going to be a lateral pull this way. You can use your door at home, especially if you have a bed, or you can even get down on the floor. You just want the anchor higher or lower depending on where you are. So, I come across here, and I'm right here, and it's pulling me laterally. So what I want to do to get more of a distraction, I want to come out this way. So I'm getting more of a pull, and then come back in. Now going out to the side is going to provide more of a distractive force, which should decrease the pain depending on what type of issue you have. If you have some type of hip osteoarthritis, it's going to feel pretty good. All right, that's number one. And while I'm changing up, please make sure you have this anchored, because if it's not anchored, it's going to come loose and pop on you. And if you have it set up like this, it's definitely not going to feel good. So, I'm going to take this off. I'm going to change the table up a little bit. Make sure we're in nice and tight. And the second one is going to be more of a long axis distraction. So I have a loop right here that I tied a knot in. I'm going to put my foot in, make sure it's fully secured. And then this one is easy. All you do is just lay back, relax, then scoot down and scoot away. And what happens is you see my foot start to lift up. That's letting you know when there's some sort of distraction occurring. And if you're on the floor, you can scoot yourself further and further away, which is going to feel good. Excuse me, up until a certain point. And then so as I'm right here, I just hold it for a little bit, and then I just hike my hip up, bring my hip closer to me, and then I just let it relax down. So I hike it up, and then relax. Hike it up, and then relax. And that's exercise number 2. So I gave you 2 different hip distraction exercises. If you have certain types of hip pain, it's going to feel good. But once again, please be sure to get seen by your physical therapist to make sure that these are the right type of exercises for you. All right, you all. Y'all have a blessed day. Enjoy the rest of your Friday.